In 2014, I was pregnant with my third child and began to have terrible neck pain. It got so bad that I basically had no range of motion without pain, and I was having to take painkillers just to function and keep up with my other kiddos. Not ideal for my health or for my pregnancy, but it hurt no matter what I did. I got connected with a local chiropractor, came up with a treatment plan, and began a road to recovery. I regained all my range of motion and got off painkillers through chiropractic adjustments and specific stretches, all with a growing belly. That was my first experience with chiropractic care, and not only did it give me my life back, it taught me a lot about chiropractic care in general. Before this experience, I hadn't really understood how it worked or the wide array of benefits beyond helping neck pain. There are a lot of misconceptions about chiropractic care. It helps with neck and back pain, for sure, but it also helps with a wider range of mobility issues. It boosts the immune system, it improves cellular health, and so much more. Now, I get regular adjustments even if I'm not in significant pain, and I take my kids too because I know how good it is for me and my family. If you've wondered if it might be a good fit for you, wondered how to find a good provider, or what an appointment might look like, this episode is for you. Welcome to the Daily Wellness Podcast, where you can learn about healthy living and be inspired to take the next step in your wellness journey. Today, you'll hear from a chiropractor with more than 15 years of experience. Dr. Chris Banks from Southwest Missouri has a passion for helping people of all backgrounds improve their ability to move better. And he explains it all much better than I do. So let's get to it. All right, today we have Dr. Chris Banks with us here to talk about chiropractic care. So Chris, I was wondering if you could just kind of describe what chiropractic care is, maybe for someone who has never experienced it before, or maybe seen it in pictures or movies and has never been to an office.
I'll be happy to. And I'll describe chiropractic the way that we approach it here, the way I approach it in my office, which tends to be much different than maybe people have experienced elsewhere. The way I look at chiropractic is it's a way to help the body be able to move the way it's been designed to function and work the way it's been designed to, so that people can live the lives, have the quality of life that they want to. In our office, we're not pain-centric in that we don't only focus on where people hurt, which is why most people go to a chiropractor. Our goal is to have a more holistic approach and say, okay, what can we do to help people just be able to operate and function at the highest level possible so that they're able to have the highest quality of life possible.
I love that. That's awesome. I think that aligns with a lot of my values. So maybe that's why I like US by Chiropractor.
Well, that's good. I'm glad to hear that.
Could you walk us through what an appointment would be like if we were to come and see you?
Yeah, absolutely. So the first time somebody comes in, we always like to take a little bit more time. For one thing, I always like to know what each person is dealing with. And something I've learned in my 15 years of doing this is that everyone is different. And so I like to know right from the beginning what somebody is dealing with, get an idea of what their background or their history has been like, to see how all the pieces fit together. And then we usually work through an exam process, addressing whatever complaints they have or whatever brings them in order really to try and get a deeper understanding of what's going on. My main goal is always to work at addressing root level issues, like root causes, rather than just maybe where the symptoms are, but try to understand what's creating that situation, so that we can do our best to address what's at the root of the problem, so that we can help people get the best results possible, longest lasting results possible, and get those results quickly.
And how do you address that? Like, once you know what someone's concerns are, like what are some of the techniques you go through?
So once we have an idea of what somebody's dealing with, then we will what we typically refer to as an adjustment. So we work with the body in a way to create better motion, better movement, or better function in that area. A lot of times people think of going to the chiropractor as getting their neck popped or getting their back popped.
Right.
And that's kind of the typical view most people have. And while there is some of that type of adjusting where you may hear kind of an audible noise when the adjustment is made, there's also other ways of working with someone that doesn't have any of those noises. So really, it's determining what the issues are so we can figure out what the appropriate approach to treatment is, and then making sure that we deliver that treatment the best we can to help get the best results possible. We also do a lot of muscle work and soft tissue work in our office too, because that's something that I have come to realize can have a big impact on what somebody may be dealing with. If there's an area that's not moving well, there's always going to be an impact in the surrounding soft tissue, whether it's muscles, tendons, ligaments, or other connective tissue. And the goal is to help try to restore as much function and improve the ability of that body to move the way it's supposed to. So we address the structural part with the adjustments. We also work with the soft tissue in order to try to help create a situation where people are doing better and doing better quickly.
Yeah. I feel like you've also helped me like with stretches, and sometimes that might help like while I'm in between visits, some things that I do. Yeah.
Well, and that's a goal of ours, is always give our patients tools to be able to have things that they can go to, especially once maybe the initial issue is doing better, but to be able to address some of those issues, or be proactive about some of those issues, in order to make sure that they're not constantly dealing with the same thing over and over again. Yeah, we like to make sure that you have as many tools as possible to work with that as you can.
Yeah. What would you say some of the most common concerns are that people come to you with?
Most people will come in with what people would typically think of. We get a lot of people who come in with lower back issues, neck issues, headaches. So those would probably be what most people come in with, just because as humans, really, we don't like to do anything about a problem until it becomes a big problem. So a lot of times, when an issue's been present for a while, then somebody will say, okay, it's time to do something about it. It's not going to go away on its own. And that's usually when they turn to us.
Yeah. Maybe sometimes they'll try to address the pain with painkillers, or, trying certain things and just not really getting any long-term relief and looking for different options. Has that been true for you?
Yes, that's something that is fairly common, where people will say, I was taking 6 Advil a day or whatever it is. I don't even know what would be considered too much anymore. But yeah, where that's just providing maybe a temporary relief, but not really addressing the underlying issues. And so that's where I say, okay, well, let's take a step back. Let's look at the whole picture and let's see if we can figure out what may be at the cause, whether that's actually something structurally at the heart of the problem, or maybe there's other issues too, such as lifestyle issues, or the fact that some people spend 8 to 10 hours a day sitting down, or other things that they could be modified from a lifestyle standpoint to help create just a better overall, more healthy movement.
Yeah, that's great. And what are some more of the uncommon reasons that people would come in? What are some unusual things that people come to see you for?
So our office is a little unique. Our office is in a CrossFit gym. So we also work with a lot of people who are dealing with either overuse issues, injuries caused from overuse, or just not feeling like their body is able to move or function the way they need it to from a performance standpoint. And that's not just CrossFit athletes. I mean, we work with people across the spectrum, from gymnasts, triathletes, runners, CrossFitters, basically anybody who's active, to help them be able to find a place where their body is able to move properly so that they can perform at the level they want to, and hopefully to prevent injuries from happening, because those are always frustrating.
Mm-hmm. I think the first time I started really learning about chiropractic care and going consistently, I was having chronic neck pain issues, because I really think it stems back to the fact that I've been in a lot of car accidents.
Yes.
And so it was great, to help me with that. And then I've just continued to go because I have learned about some of the other benefits. So even if I'm not in a lot of pain, I'm still wanting to get chiropractic care for some of those other benefits. And one thing that I learned is just the connection to the nervous system that chiropractic care addresses. I mean, can you kind of talk about that? How does that connect to our?
Yeah. So without digging too deep into the weeds, if you think about how our bodies are designed to function, The brain operates as kind of the master control system for the entire body. That's what is running all of the different systems throughout the body without you having to consciously be aware of it, which is good, because if I had to consciously tell my heart to beat and my lungs to breathe and my stomach to digest and all these things, I would forget one of those and I would suffer the consequences of that. But we don't have to worry about that because our brain runs all of those systems automatically. And it does so through the nervous system. The main branch is the spinal cord, which connects the brain to the body, as the nerves branch off the spinal cord and then go, out to the rest of the body. And the spine is kind of the main conduit. So that's what forms basically the protection for that spinal cord to be able to travel from the brain and then take the nerves further out to the body. When there are issues with the spine, there can be instances where the body is just not able to operate at its full capacity. And what that looks like, that may look like different things for different people. And I always tell people up front, like, I'm not here to say I fixed anything. Like, as a chiropractor, I would never claim to fix certain conditions or certain things. What I have seen and what I can tell people is when your body is operating as close to 100% of its capacity, it's close to 100% of its ability the way it was designed, things do better. And that's ultimately the goal. By working with the spine, yes, we want to create a situation where the entire body is working better, whether that's allowing the communication process between the brain and the body to happen more closely to the ideal, whether that's more full range of motion, whether that's, being able to do things that people haven't done for a long time. Really, it's about just helping create a situation where that person can be at their best.
Yeah. I think that kind of brings in some of the other benefits that I've experienced or seen in some of my friends or family, things like helping with their allergies and asthma.
Yeah, that's a big one around here, to speak of, especially this time of year. Just creating a situation where the body is more able and has the capacity to handle some of those things. But yeah, allergies, asthma, I've seen people with my chronic digestive issues improve. I've seen people with chronic headaches be able to enjoy life without headaches. There's a lot of things that you see. Like I said before, I would never tell somebody that was fixed by the adjustment or the treatment. Really, that is just the body's ability to be able to heal itself from the inside out and actually start to see improvement in some of these areas.
And what you just said really connects to the immune system as well. If your body is communicating well and all those cells are getting what they need and, working properly, then your immune system is going to be functioning a lot better as well.
Yeah, right. Yeah, if you can create a situation where everything is functioning as close to 100% of its capacity as possible, whether that's immune system, cardiovascular system, lymphatic system, whatever system you want to name, the body is just going to be healthier overall.
Yeah. You mentioned helping people that have desk jobs and sit at the desk for 8 to 10 hours a day. What are some practical tips for people that struggle with that just because of their job?
Get moving. That's the number one thing. Now we're really big on movement. Movement is really at the core of what we do and how we approach things, both from a health standpoint and a chiropractic standpoint.
Yeah.
So our bodies are designed to be moving. That's been in our DNA from the beginning, is to move. Movement was essential to life. Anything that didn't move died pretty quickly. And that's something that, as our society and technology has kind of changed whether it's work requirements or just what we do in life in general, to more sedentary, static positions, like that has had an impact on just how our bodies are able to function. So my advice is always to get moving. We say, movement is life. The more you move, we're designed to move, the better. That's what that looks like, though, can be different for every person. And really the main thing is to say that we tell people is you start where you're at, do what you can do, and build from there. And I wouldn't ever ask anybody to go straight from the couch to run a marathon. Like that wouldn't work. But there are things, and I've seen many patients who would start with just being able to go for a 10-minute walk around the block. And that builds. And then 3 years later, they are running a marathon, and they would have never expected that from themselves where they were 3 years ago. But just by getting started, they were able to then feel the benefits, see the benefits, and then that has become something that's in a way transformed like their life, because now they are active, they are more healthy, they're able to be more engaged, and their quality of life is better.
Yeah. Just on a personal level, I'm curious why you chose this as your career.
Because I didn't want to sit behind a desk. That was a lot of it. I did not want to be stuck in a cubicle somewhere doing a typical job. I've always been interested in healthcare in general. For a long time, I wanted to be a dentist, until I realized that would require spending all day like inside people's mouths working, and I was like, I don't know, that doesn't sound like as much fun. But when I was in high school, I had an opportunity to do kind of an internship where I spent some time in a chiropractor's office, just kind of helping out around the office. But it gave me a chance to see what things look like on a day-to-day basis, and that was my first real up close look at what chiropractic was. And one thing that really stuck out to me was that people always left feeling better, doing better, better off than they were when they came in. And I was like, oh, that seems like that would be a pretty cool way to spend your day, helping people get to a point where they're better when they leave than they were when they got there. And so that was kind of really the start for me. I've always been someone who's been interested in being active, played sports growing up, and just enjoyed that part of life. And so it was a pretty natural progression for me to go from kind of that aha moment to say, okay, what do I need to do to get to that point? And, after enough schooling, I made it to that point.
Yeah, a lot of schooling.
A lot of schooling.
Yeah, I think with your values, that seems like a great fit for you. It has to feel pretty rewarding.
Yeah, absolutely.
Yeah.
I enjoy every day. We all have good days and bad days, right? Like that's just normal as a human. But I can honestly say that coming to work is not ever something I dread. I enjoy the fact that I get to be where I'm at, doing what I do. And again, knowing I'm helping people be able to live life better.
Yeah. One question people have asked me as I've talked about chiropractic care is how often I go. Like, would you recommend a certain amount of time between visits, or what would you say?
Again, it gets back to everyone's different. So that's going to be different for each person. And I think that's the approach I take. It depends on what's going on when somebody comes in. And honestly, like, if somebody's coming in and they're in pretty bad shape, it's going to take a little bit longer for some of those issues maybe to be addressed and for them to get to a place where everything is moving and functioning well. Some people may come in with no complaints at all. Like I have some people come in like, I'm not hurting, I don't have any issues. Some people say I'm crazy for coming in. It's like, no, that's the best time to come in, because then we can skip the whole process of having to put all the fires out before we can actually start getting things moving forward. So really depends on where somebody's at when they come in, what their goals are, and then we find what works best for each person. And I will say for most people who come in, because of how we approach things, it does not require maybe as much frequency as people think. I have a lot of people who come in and they're expecting to hear, you need to come in 3 times a week for 3 weeks and twice a week for 3 weeks or whatever. Because of how we approach things, addressing the entire issue, working to help get to those root causes. And then also too, a lot because we're working both with the structure of the body and then the muscular side, the soft tissue side. People see results much more quickly, so that's usually not necessary. So I'd say typically somebody would start out maybe once a week for 3, 4 to 6 weeks, depending on where they're at. And then we try to start stretching things out as quickly as possible. My goal would be for someone to get to a point where we're able to focus more on maintaining progress, which is usually about every 4 to 6 weeks for most people. And that allows us to be able to address issues before they become problems, as well as making sure that people are maintaining a high quality of movement and able to do all the things that they want to do.
And chiropractic care can be for someone of any age.
I have patients from infants to elderly. I've worked with people through my career of all ages, sizes, backgrounds. Yeah, it can be honestly for anybody who wants to be the best version of themselves that they can be. Yeah, absolutely.
You've kind of mentioned that there's different styles of chiropractic care or, philosophies and how they approach care. So what were some tips that you could give somebody about how to find a chiropractor that's a good fit for them?
The number one thing would be to find somebody who listens. I think that's important in any healthcare professional. It's not necessarily everyone is going to have that ability or desire. But I think finding somebody who listens, who kind of hears where you're at as an individual, who understands what your goals are and is willing to work with you to help you achieve those goals. I think that would always be the number one thing. And then to find somebody who can approach you as an individual. There are a lot of different ways to work with the body from a treatment standpoint when it comes to chiropractic. Some people specialize in one specific way of doing things. That may work for some people really well and may not work for some people. I try to have as many different ways to approach an issue as possible so that I can try to help as many different people as possible. And I'll tell people up front, like, if something doesn't seem to be improving, tell me so we can try a different way of approaching the issue. But I think that would be my number one piece of advice, is find somebody who can listen, somebody who is willing to work with you as an individual to help you get where you want to be.
Great advice. I just always wonder, like, as a chiropractor, are you always analyzing people's posture?
More than I like to admit. Posture, movement is a big one, just because movement is something we really focus on.
Looking at people, like
how people walk. And we spend a lot of time in the gym. And so, like, I just coached the new CrossFit class. And so, without even realizing it, you're watching how people move to say, okay, how can I help them move more efficiently or move better? But yeah, like when we go to, go to church or go out to, to eat or go to the store or something, like, you're watching people just walk and lift things or, bend down to pick stuff up. You're kind of like, oh, you just want to run over and try to help them know they can do it better.
Yeah. So, okay. So the main tips that I'm taking away are really chiropractic care can be for anyone, like any age, no matter what your pain symptoms are, or even if you're not really in pain, that it can still
absolutely
benefit you. Moving is a big key to health as far as your body function and things like that. I guess, what if someone just kind of has a fear of coming to visit you? I have seen that, like, in some friends or children sometimes. How do you kind of get them past that?
I try to make sure I have ways to work with anybody. So again, a lot of it gets back to what people kind of have in their head as far as like what chiropractic is. I think, okay, if I go to the chiropractor, I'm going to get my neck popped, or, and some people are not comfortable with that. And that's not necessarily true. Like, there's a lot of different ways that we can work with the body that doesn't require high force or any force at all. I think, in the office, you've seen the table that we use that can allow us to work with lower backs and hips without having to put people in a position that might be uncomfortable for some. So really just to have as many different ways as possible to work with people. And then just understand, like, what they're nervous about. Like, a lot of times, again, it gets back to just listening. And you can, if you listen to people and you can understand, what their goals are, what the main issues are, and then you can help them feel like, okay, I believe this is something we can help out with. There's a trust that's built, and that's a big part of kind of getting through maybe some of those fears, to say, okay, everything I do is always with your best interest in mind, and I'm not going to do anything that either you're not comfortable with or I don't feel is best for you, to make sure that people get the best results possible. But I'll have people like, don't touch my neck. I'm like, cool, I won't unless you ask me to, in which case, we will, and we'll do so in a way that make sure you're comfortable with. But really, it's just kind of meeting people where they're at, and then doing everything possible to help them walk out doing better than when they walked in.
Yeah, I think getting my neck adjusted is my favorite part. So
yeah, let's have to be like, oh, please,
yeah, please touch the neck. Yeah,
right.
Yeah. I had 3 questions that I always ask everyone at the end of every podcast, and so I know you're always learning about health and wellness in general in your life. And so, what is one healthy living resource that you would recommend to people that they want to learn more? Could be about chiropractic care, but it could just be about health in general. Like, where would you point them?
The internet. Sometimes it can be difficult to kind of wade through all of the information out there. I think probably the thing that's been the most beneficial for me, there it is to try to find those sources that are most trustworthy. When it comes to chiropractic, like, there's a lot of research across the spectrum. And so, like, finding people who are able to kind of wade through the research and understand, like, what the research is actually saying, kind of free of an agenda. And so one of my favorites just from a professional standpoint, is done by a group called ICE, which is Institute of Clinical Excellence. So it's a group of physical therapists who are also nice enough to let us as chiropractors learn with them as well. But they have done a good job of going through and kind of walking through some of the research as far as like, here's what is being shown from the standpoint of healthcare, basically being proactive and helping people be more healthy versus kind of our reactive tendencies when it comes to healthcare that's presented through most, kind of in most settings now. I don't have like a single, I'm trying to think, I feel I'm kind of drawing a blank as far as like a specific like source of information. But really it's like find the voices who are not trying to sell you anything, who don't have an agenda, and who really just try to help present the truth and then be able to take those nuggets of truth and apply those.
Yeah, I love that. That's a big value for me, is preventative health, preventative healthcare. So I think that's great. What is one healthy snack that you love?
So it changes. Like there's sometimes when when it may be different types. I'd say probably my favorite healthy snack right now, I'm really enjoying berries. Just like we've been doing berries. We'd like to put berries in our boys' lunch for school. And I always like to help myself to what we have in the fridge when we have them. I also like high protein snacks. Usually I'll keep some like jerky or like meat sticks, not that are not highly processed, and I can have on hand, because my body seems to operate best with higher protein intake. So that's something I try to make sure I have, so I don't crash in the afternoons, run around working with people. But that's probably my two favorite right now would be berries, and then have some source of protein that's easily accessible.
Yeah, great. And the third question is, can you think of anyone that you would love to see as a guest on the Daily Wellness Podcast?
So I don't know if you have talked to Eric Bartlett over at Bartlett Shoes. He's an excellent resource, and he's got a really, really cool story too, as far as like some of the changes that he has seen in his own life through being active, and changes in his health as well. So that would probably be one that would be really cool. We've had a lot of conversations in the past, and he's one of those people who I'm kind of like, all right, you're one of my people. Like we operate on the same wavelength in a lot of ways. So I think that would be a really cool guest for all of your listeners.
Yeah, thank you for educating us and helping us to understand more about chiropractic care and all the benefits. Yeah, is there anything else specifically that you want to touch on before we go?
No, I really, really enjoy what you're doing. And I think just being able to change the conversation a little bit about health and what health is important. I think something that has started to see a little bit of a way or a little bit of momentum towards looking at health differently. For such a long time, health was something that was defined as the absence of things, whether it's absence of symptoms or the absence of this or that. It's like cardiovascular. I'm healthy because I don't have high blood pressure or that sort of thing. I'm really passionate about changing that conversation and say, let's not look at health as an absence of things, but let's look at health as something that is more of a positive goal. Like it is the presence of a heart that's functioning properly. Because the heart's functioning properly, then you see, that people don't have to take medication or have to worry about their blood pressure. And really changing people's mindsets, hopefully, as far as health is not the absence of things, but it's more your body being able to operate and function as it's designed. And when that happens, people are going to live healthy. They're going to be able to enjoy a high quality of life, and really, just that simple change can have a huge impact on how somebody is able to to live out their days and live out their purpose.
Thanks for listening to today's episode on the Daily Wellness Podcast. We hope that you found it helpful for your own wellness journey. And if so, we'd love for you to leave a review. Then come back and listen for review shoutouts on upcoming episodes. For more information, check out the show notes and connect with us on our website, dailywellnesscommunity.com.